Hi everyone, how are you? Welcome to another question and answer session. A 53 years old man is on the intensive care unit following an emergency abdominal aortic aneurysm repair. He develops abdominal pain and diarrhea and is profoundly unwell. His abdomen has no feature of peritonism. Which of the following arterial blood gas picture is most likely to be present? So in this question, a patient which is emergency unit following the abdominal aortic aneurysm repair and sudden develop abdominal pain, diarrhea, and profusely unwell. So in this condition, what type of metabolic abnormality develop? Usually metabolic acidosis. So here this is the metabolic acidosis, and they are the different type of option. Here we can see the different type of option, but we know in case of acidosis, when the pH is less than 7.35, then it is acidosis. In case of both respiratory and both and the metabolic, so both respiratory and metabolic case, so when the pH is less than 7.35, this condition it is acidosis. So first of all, we have to find out the pH in this equation which are less than 7.35, and here we can see the 7.45, it is not 7.35, not 7.2, it is the option 7.29 also, and 7.3. The all the pHs are less than 7.35. So our answer located within this three equation, and we have to find out the correct answer of this ABG. So the any type of the ABG question solution or acid base balance or arterial blood gas analysis, we have to remember this equation, which is pH is directly proportional to bicarbonate and pH is inversely proportional to the bicarbonate. And another important point to remember that the bicarbonate is directly related to the metabolic cause, and partial pressure of carbon dioxide is directly related to the respiratory cause. So in case of metabolic acidosis and alkalosis, bicarbonate affect first, and in case of the respiratory cause, the partial pressure of carbon dioxide affect first. So in this scenario, metabolic acidosis. So in case of metabolic acidosis, first of all, the change will be within the bicarbonate level. So in case of acidosis, that means the metabolic acidosis or any type acidosis, pH decrease. So this point is very important, and the first point is pH decrease, and the second option, as it is the metabolic cause, so bicarbonate level will be decrease. As the pH decrease, bicarbonate will decrease, because the bicarbonate is directly related to the pH. And when the bicarbonate reduce, our body system compensate by which? The compensate by partial pressure of carbon dioxide to maintain the pH near normal. So for this purpose, the partial pressure of carbon dioxide also reduce. So this is the normal position of a metabolic acidosis. That means the pH is first of all reduce, then partial pressure of then bicarbonate level reduce, then partial pressure of carbon dioxide initially normal, then gradually reduce. So in case of metabolic acidosis, all the parameter reduce. But first of all, we have to know the normal level of these three important parameters. So here we can see the partial pH. pH normally 7.35 to 7.45. When the pH is less than 7.35, it is acidosis, and when pH is more than 7.45, then it is the alkalosis. So when it is more than 7.35, 7.45, it is alkalosis. When less than 7.35, it is the acidosis. Then the second important parameter is partial pressure of carbon dioxide. And here we can see the normal range of partial pressure of carbon dioxide is 4.5 to 6. It is very easy, 4.5 to 6. And third most important is the bicarbonate level, which is 22 to 28 millimole per liter. So this most three important parameter are here, and we have to remember very carefully. Other options such as here we can see the anionic of 10 to 16, partial pressure of oxygen 11 to 14, chloride 98 to 107. So now see in this question, as it is the metabolic acidosis. So first of all, pH reduce, and we can see the pH reduce in this three equation. So our answer within this three equation. Then second, we have to look for bicarbonate level, and in case of metabolic acidosis, as pH reduce, so bicarbonate will reduce, but here is no bicarbonate level. So the third point, we have to look for partial pressure of carbon dioxide, and partial pressure of carbon dioxide will be normal or reduced. So now we have to find out partial pressure of carbon dioxide, which is normal or reduced, and the normal range of partial pressure of carbon dioxide is 4.5 to 6 kilopascal. So we have to find out a range which is less than 4.5 or equal within the range. So here, first of all, in the last equation, we can see partial pressure of carbon dioxide, which is the 4.8, which is normal. Then second option, here we can see the 5.9, which is normal, but near the above range or higher range. In case of B, 4.8, this is the middle range. But in case of C, here we can see 3.5, which is very less. So here we can see partial pressure of carbon dioxide, normal or low. So here is low, so this option is more true. And here the base axis and lactate. In case of metabolic cause, there will be lactate will be more. So here lactate is more, and base axis normally plus minus 2, but here we can see it is minus 10, which is more. So in case of metabolic acidosis, in this question, our answer is C, because first of all we have to see the pH in case of metabolic acidosis, it is low. Then look for bicarbonate level, and bicarbonate level is low. In this equation there is no bicarbonate level, so we have to look for partial pressure of carbon dioxide, and which will be usually low or normal, and here the low present, so don't look for normal range. So this is the low. So these three important parameter we always have to remember to solve any type of the abg question, and our answer is C. And the base axis and lactate also increase in case of metabolic acidosis. Thank you all.